Okay, I would like to call the Human Services Committee meeting to order for November 12th. Do I have a motion to approve the minutes?
I'll make a motion.
Do I have a second?
Second.
Okay, all in favor?
Aye.
Aye.
Aye. We have privilege of the floor now. Is there anyone here to speak to privilege of the floor? Anyone to speak to privilege of the floor? Seeing no one and hearing no one, we will close that, and we will go to our first proposed resolution to amend the 2025 budget for public health.
Hi, Diana Songer, Deputy Director of Finance for Human Services.
Dr. Mike Falk, Chief Medical Officer.
Lacey Wilson, Public Health Director.
This resolution is to amend the 25 budget for public health due to expenditures exceeding the budget while others had a surplus. We are requesting authorization to increase appropriations in the amount of $540,000 and also decreasing appropriation accounts totaling $540,000. This is a budget neutral resolution.
Okay. Do I have any questions or comments? Anyone?
Sure.
Okay.
We'd be disappointed if you did.
So just looking at throughout the proposal here, we are utilizing some funds from the medical examiners and coroners and stuff, and also some other various departments here. A couple of them are pretty small, but a couple of them are pretty big. Why do we have such a surplus in a couple of those departments?
So I think mostly because we've realized some improved efficiencies within those areas, within those divisions. With the coroner program specifically, we are now able and have the ability to not send as many decedents up to the medical examiner's office in Erie County, which is saving on some contractual costs, which is the majority of that. We also have been able to realize some savings with reduced transport costs because we are doing the transports ourselves, and we're realizing some contractual savings there. In regards to the person
On that, would you say we're better than you anticipated? It sounds like it might be, but I don't want to put words in your mouth.
I don't know that we're better than we anticipated, but we are also seeing some continued reduction in overdose deaths as well. So I think that is also reflected there.
Good.
In regards to some of the personnel savings in some of the other divisions, public health admin in particular, we've also again realized some efficiencies. We've had some vacancy savings there throughout the year as we kind of look at our strategic plan. We have not pulled the trigger as quickly for some of the refills, and so therefore we've been able to conserve a little bit on that end as well. So
Now on the appropriation side, why, how 300 for the jail clinic, what's the
yeah, so
expenditures?
there's a few things there. That is the most glaring of the several items there. We had an increase in the census in the jail earlier this year, and that remained pretty consistent over several months. Higher numbers of incarcerated individuals equals higher medical costs, and we have seen an increased frequency of individuals coming in with opioid withdrawal and opioid dependence, probably more so than 2024. There's weekends that we have 10 individuals coming in over the weekend, all requiring treatment and MAT treatment. So we have improved our efficiencies. We've been able to get these folks onto treatment quicker, and therefore, those expenses have increased. I have had a meeting with the sheriff and the warden as recently as last Friday to really start thinking hard about how we're going to contain these costs. We're looking at $800,000+ for just medications for medication-assisted treatment within the county jail. We think that we can make a transition to more oral medications within that setting. There's a lot of moving parts there, and but we're confident that we're going to be able to make some strides moving forward in the next quarter or so. You know, our 2026 budget does not reflect that necessarily, and we want to move slowly so that we can be sure that we do it safely. There are security risks, diversion risks of a controlled substance, and we have to be really careful from an operational standpoint how we move forward with that, but I think we can do it. With that, may require some additional staff. So even with that, I think that we can see some significant savings. You know, I hope that we can realize, you know, $500,000 of savings in 1 year if we can pull this off. But it may require some additional help, either on the nursing side or on the correctional side. So we'll see how things go once we decide to operationalize it, so.
Is that there was 2 choices on the type of medication you give people, so
Yeah.
you're making a different choice then?
Yeah, the oral medications are much cheaper. You know, right now, we have roughly 65 individuals on the MAP program. Only a small handful of them are on oral medications. The vast majority on a long-acting injectable that they get once a month. But with that, it's a $1,500 expense every month. Oral medications are gonna be, you know, 20, 30, 40 bucks a month, 50 bucks a month. But, you know,
Per
you
individual.
have to, per individual, so you have to administer that medication sort of separately from the other medications because it's a controlled substance and because there's risk of diversion of that medication. So, those individuals right now are escorted from one place in the jail to another place in the jail. And you could imagine doing that for 60 individuals a day. That would really place a lot of extra work on the correctional staff and increase the risk of security issues and that kind of thing when they're not in necessarily a secured location. So we're looking operationally at some things that we can you know, make the move to safely administer those medications, but reduce those risks.
Go ahead.
I was just gonna say, that oral medication is effective, or as effective, it's just more
Yeah.
cumbersome to administer?
Right.
Okay.
Have you been in any of the discussions regarding setup of a potential jail upgrade and redesign? You know, some of that is in a process of getting discussed and updated, and you know, I think having a proper place is important, and I'm sure the sheriff has talked with you about this too.
Yeah.
But you know, of what detail? Because it isn't, you know, if we could make that transition, I know switching to the other medication poses more stress on the sheriff's department as far as the correctional team. So the once a month administration is much easier because you have one person, but the costs variations and but you know, if you could administer the orally stuff in a more easier manner because the jail was set up a little easier for it may help streamline that a little bit.
Yeah,
So
we have had input.
Yeah.
When they came in to do the consultants came in, we were able to provide some feedback extensively, so.
great, because
Yeah.
that's now's the time to kind of rethink that as this MAP program is not probably going away, right?
Right.
So you're gonna have a long-term need to
Yeah, and it just as a reminder for everybody, we've had, over the last couple of years, we've been fortunate enough to be able to utilize opioid settlement funds to help offset the costs. So within our 2026 budget, we are utilizing $750,000 for MAT medications. But those funds are not gonna last forever. They are coming in steadily, and they probably will for the next 10, 15 years. But they will dramatically reduce likely after this year, or after 2026. So we have to be mindful of that. And I really do not want to be, sitting here next October saying, well, we're still looking at $1 million budget for our MAT program. And so we're working hard on that. So we're hoping that we can make a big dent there, so.
A few years from now, I want to see you back with this same similar sort of resolution, and the decrease appropriation account as contractual clinics, jail, so.
Yeah, that's right.
It's on the bottom.
We'll be there, I'm confident.
What about the early intervention? How come, because that's substantial too.
So that's actually related to a state platform change that they made that interrupted the Medicaid billing cycle. So it looks like it is an
Oh.
increase, but it's really not on the end of the county. It's really on the state platform error side.
Okay.
So we have to,
Not
So we have to-
getting the reimbursement from the state. We're delayed in getting.
We're
the
delayed in
We're
getting
delayed,
reimbursement from
so
the state.
in 26 it might be a different story.
So Diana can probably speak to this a little better. There has to be a balance that's carried in the escrow account that we pull from. So this is technically, I think, reimbursing the escrow account. You should speak to this.
Well, the reimbursement would be higher if the system was working the way it should. So the hope is that when it's corrected, the revenue will increase to offset the difference in expenses. But we don't know that for sure. We won't know that, so we're kind of planning on no, and if it comes in, great.
So the system was working correctly and
It's a
then,
new,
Yeah,
it's a
so
new
it's-
so then they
platform.
changed it and screwed
Yeah,
it
so
up?
it's a state mandated system. They provide the platform for all of the documentation, and all of the billing hours are pulled through that documentation on that platform. And the state changed that platform this past year. We are not it's every single county in
Sure.
the state has, had an issue with this. And the state association has been very actively lobbying the state in terms of, correcting the issues and correcting the mistakes, because it leaves the counties in a bind.
So that's purely paper adjustment type of thing?
Mhm.
Okay. Anything
Yeah,
else?
this has nothing to do with the budget, but you mentioned overdoses were down, like average weekly, or is it an average monthly? What kind of, because the
Month.
reason I'm asking is because I look at the obituaries, and I see a young person died unexpectedly,
Mhm.
and my first thought is, did he overdose?
Yeah, month over the last year, it's been a continued decline. So from year to year, we are seeing, so from 23 to 24 to 25, it has declined from
So
24 to
like
25.
right now, what's the monthly average right now?
You would know what
I would say three to four. Don't quote me on that, but, prior to 2024, we were looking at about 60 per year.
I thank you for that too, because you gave us a report a few months ago on paper and in person.
Yeah.
Was that September or was that August?
August.
Thank you.
Um,
I did. They told me to.
Yeah, but between 24 and 25, we saw a 50% reduction.
Good.
So, we're probably somewhere, it varies month to month, week to week, but.
Is it because the young people are getting smarter not to use that stuff, or is there less coming into the county?
It's a whole socio-ecological really shift that's occurred nationally, statewide, and within the county. We do track at a better rate in the county than nationally. So nationally, they're seeing between 10 and 30% reduction. The 50% reduction that we see here has a lot to do with just the collaboration of partners and stakeholders in the county, increased information and awareness to individuals. harm reduction sort of approaches in the communities by, our nonprofit organizations, things like that. And then outreach and treatment through partners like mental hygiene clinics, prevention strategies with Prevention Works in the health department. So it's a really multi-pronged approach that's come together, and you see it working. And then at the
Definitely
federal
working.
level,
It's
yeah,
definitely
federal level too, I mean, you do see a lot more, regulation and a lot more of a, I guess, a more public approach to mitigating the influx of substances into the country.
Our local law enforcement is very active here as well.
Oh, I see that in the paper all the
Yeah,
time.
I mean, just knowing, being on the receiving end of these individuals coming into the jail. Unfortunately, there's not a lot of other sort of acute options in that moment for some of these individuals. And, we really try hard to get on top of things within a few days. And I know that we're making a difference. This is not, the jail MAP program is not the whole difference in the county. Obviously, it's a very small sliver. Our folks in mental hygiene and the clinic work that they're doing and all the programs that they're running, our Narcan programs and all of the other aspects that Lacey mentioned are playing a huge role here. But
And this is when it's great to be we talk about this a lot in the public health side of things. We're just large enough to have some resources and capacity, but we're small enough to be very well connected and work very well together across the whole county. So that it's a benefit in these areas that we can work so closely together and really see a difference.
Okay, anything else? Not, all in favor?
Aye.
Aye. Opposed? Resolution carries.
thank you.
Thank you. Next proposed resolution is to amend the 2025 budget for Veterans Service Agency.
Diana Songer, Deputy Director of Finance for Human Services.
Greg Carlson, Director of Veteran Services.
This resolution is to amend the 25 budget for some expenditures exceeding their budget while others have a surplus. We are requesting authorization to increase appropriation accounts and decrease appropriation accounts in the amount of $12,600. This is due to a building rent increase due to the Dwyer program not offsetting that expense. Thankfully, we were able to offset it by some savings in the employee benefits, and it is a budget neutral resolution.
Any questions? So was that reflected in the 26 budget then?
It
that
is,
Dwyer?
yeah. So
Okay.
the one thing that's not reflected in the 26 budget is obviously with the recent election, there'll be some changes. So there will be some cost savings in employee benefits in 2026, regardless of how they do it.
Sure.
Yeah,
Yeah.
how they do this would be some there. But yes, this was all accounted for in 2026.
And the Dwyer grant not covering it, that was kind of a surprise, or?
No, so it's one of those things where, I'm trying to think of the most simple way to say this. Don't be sad that it's over, be happy that it happened. So for a period of
Right.
time, we had the Dwyer program that was able to subsidize some of our costs. We knew that that wouldn't be forever. Eventually, the program would change, which it has. So for a period of time, they assisted us with rent costs. That we didn't have that prior to 2017, and then that ended. But we were able to offset that this year because Dave Adams retired unexpectedly, so the Dunkirk office was partially vacant from January to May.
Okay.
So it kind of came out in the wash. But yes, for the 2026 budget, we have it, everything
Accounted for.
in accordance with it, yeah.
Okay. Anything else?
You're supposed to say it's gonna be an increase in wages next year, because there's no way one individual can fill your shoes. You're gonna need to hire two. You know?
That would be dishonest, you know? I'm a politician now, I have to be honest, right? Isn't that the rule? I know mine's not nearly as excited as Health and Human Services. They always have way more interesting conversations than I do.
That's fine. Anything else? All in favor?
Aye.
Opposed? It carries.
Thank you.
Thank you. Up next is a proposed resolution, authorized lease agreement with City of Jamestown for office space for Chautauqua County Department of Mental Hygiene and Social Services. Ooh, I'm listening. Oh, here comes everybody.
Carmelo Hernandez, Commissioner of Mental Hygiene and Social Services.
Trish McLennan, Deputy Director with Mental Hygiene and Social Services.
Blake Uhrig, Director of Administrative Services.
So this lease is for the third floor in City Hall, where we will have our homeless team and our mobile crisis team co-located in the same location. And one is to provide a better continuity of care for our residents from the mental hygiene side and also the social services side when it comes to homeless, unhoused, potentially sanctioned and/or that are dealing with behavioral or mental health crisis.
Okay. Any questions? I know Pierre had a question from yesterday.
It was answered.
It was? Okay.
Trish answered it, so go ahead and answer it.
Yeah, could you answer it for me?
What was the question?
The
The question was, where are they relocating
Jeopardy
from?
here, huh?
Yeah.
The question was, where is the money for mental hygiene? It was mentioned in the resolution that there's a lease for it. It's at Warwick right now, mobile crisis team is, that's about $1,200 a month. So they will be completely out of that and into this, so that's where that funding is coming from.
Okay, so that,
So
but
it's
that's where
making
they're
it right.
relocating.
Correct, they're relocating from,
Okay. Sounds good. Anything else?
Well, if everything goes right, the government will be back open tonight. How soon will you guys be back to normal?
I believe they're voting tonight at 9 p.m., 2100 hours, and if everything goes well, it'll be reopened tomorrow morning. And I could answer a couple more questions if you guys want on SNAP and HEAP.
We're gonna have that discussion
Okay.
later, so let's deal with relocating this first. Any other questions on this resolution?
No.
Okay. All in favor?
Aye.
Opposed? Carries. Thank you. Can we do the late resolution before we have that discussion? Yeah. And then we can have the discussion. So we have a late proposed resolution, and it should be on your desks. Lydia passed them out. Authorize acceptance of the Univera Award to Chautauqua County Office for Aging Services for the evidence-based wellness programming.
Good evening, everybody. Dana Corwin, Director of the Chautauqua County Office for Aging Services.
Carrie Skelton, Nutrition and Wellness Coordinator at Office for Aging Services.
Good to be here this evening. The resolution in front of you is some work that we did. We were just talking about this about 12 to 14 months ago. We had applied for a general pool of funds that may be made available through Univera to the public and to the community. So we found out a couple weeks ago that we were a recipient, and they'd like to give us a $5,000 donation, and that is to be applied to the evidence-based and wellness program.
What is the evidence-based wellness program in a nutshell?
A part of the Older Americans Act, there are Title III-D funds that are specifically used for what they call evidence-based programs that have been peer-reviewed curriculums, and there's a list of 50 of these different programs. The ones that we currently implement in our county through subcontracted partnerships are the Diabetes Prevention Program through UPMC. We do the WISE program, which is Wellness Initiative for Senior Education, through the partnership with Prevention Works. We're working on partnerships to do a falls prevention, either through UPMC and/or Brooks Hospital at both ends of the county, and several others. The list is about 50 programs long that we can choose from.
So this money will help facilitate
Yes.
some.
Expanding that.
And what we decided to do a few years ago, about 2 years ago, is move that work outside of the agency. And so these monies are specifically earmarked to help do the training for a community-based organization that will partner with us so that we have a further reach into the community.
These evidence-based programs require certified trainers, and the trainer has to apply and go through rigorous training to be able to have the fidelity of the curriculum of the programs. And training costs can run anywhere from $600 to $1,200 per certified trainer.
So as we look to lift off the health and wellness program in the community, it's really in and around how do we keep people well at home? How do we focus on health, whether it's cardiac health or diabetic health or pre-diabetic health, fall prevention are all important things that we can go out and educate the community with. But we find that it's more fiscally sound to branch this out into the community rather than to keep it in-house. I think we can get more done that way.
Through community organizations.
Community partnerships.
Right. These partnerships, we're asking our partners to be able to, if they're not housed at a hospital, we're asking them to implement programs, North County, Mid-County, South County, at least twice a year. So a total of 6 programs being run per year by each agency for each of these non-evidence-based programs. That way we are able to really bring the programming to the community and not have to worry about transportation.
Right, and there is no cost to the older adults that would attend these classes. It's all born of pieces like this.
Okay. Any questions? Comments? Okay, I appreciate the work involved in this. All in favor?
Aye.
Opposed? Carries, thank you.
Thank you.
Thank you.
Dana,
Okay,
Dana.
so
Dana,
Yes, I heard it, but I had to go.
when is this?
now we are going to have discussion, updates on the SNAP and HEAP by Carmelo. Thank you for being here, Carmelo, and whoever else wants to join them.
It's just me.
Just you, that's fine. That's fine.
You're the target.
So where are we at?
Government is supposed to be voting tonight to reopen at 9 p.m., 2100 hours. The state of New York, the governor did submit funding into the FNS system, and this, which is basically the vendor that provides the SNAP benefits. And as of right now, they're processing at warp speed at the state level, and everyone is receiving their benefits at 100% for the month of November. OTDA canceled their call today because they're still uploading documents, making sure that everybody gets their subsidy on time. The other piece that comes along with that is they're also processing November new applications for November and paying those out as well, and they're also processing October's as well. So they're not only doing current recipients, they're also doing recipients that have recently applied. So that's good news.
And they'll get those SNAP benefits immediately? in the near
Oh, some
future?
people already have started. They actually started November 10th. So I guess the account on our end, we saw $1.2 million distributed within the county November 10th, and November 12th, it was at 2.7 million. So people have been receiving their benefits.
Okay.
And that's from New York State?
New York State utilized their funding and uploaded into FNS. There was I'm pretty sure you guys heard about it. There were some local courts that told the federal government, hey, you need to do this effective immediately, ASAP. By that time, Governor Hochul had stated, we're going to go ahead and fund it ourselves at that point in time. Then the Supreme Court came back and said, hold, we got an appeal, but it was already uploaded and they were already working on it since 12:45 on Friday.
Okay.
Carmelo, you mentioned at our emergency meeting a week ago that really there hadn't been a lot of interaction between our community and your office. Had that changed? Has that changed in the last week?
No, calls in terms of asking when are my benefits going to come in. OTDA did not have to send out the mass communication because the governor made the decision that she made. So instead, the mass communication that they did make was, this is the date you're going to receive your benefits, and they were just processing them. So a lot of people in our community, I don't want to assume, but we're probably just waiting to receive the mass communication, and the mass communication they received was, you're going to be paid in full.
Thank you.
What about HEAP?
HEAP, that is what we hope is OTDA right now. If we receive them, they're going to tell us to process it as an emergency. But what they're waiting for is the federal government to reopen, which hopefully that does happen effective immediately tomorrow morning. And this way we can know where the plan stands and also the reimbursement that we're going to receive from the federal level, which was at 100% last year, well, and many years before that also.
Okay.
So Carmelo, just to be perfectly clear, the recipients in Chautauqua County of the SNAP benefits will receive their November benefits regardless of whether the federal government opens up in the next days or weeks.
For the month of November, absolutely.
Correct.
100%.
100%, absolutely.
Just wanted to be clear with that.
Absolutely.
Thank you.
Is there anything we need to do?
Pray that they open up tomorrow morning. No, I think at the moment, I think things are calming down. I think cooler heads are prevailing. I think they're having the necessary tough conversations that are needed to have. I think the next big conversation that needs to happen is around HEAP. I think SNAP took the forefront, as rightfully so it should have. And I think the next call that we have that's scheduled for tomorrow with OTDA is going to be more focused on HEAP and what is happening at the federal level. And our lawyer is going to get involved with that the same way they got involved with the SNAP. So that part wasn't really clear from the state level just yet, but SNAP was the priority.
Well, heat's pretty important too, especially now. So the state is not doing anything about HEAP at the moment.
At the moment, no. At the moment, it's SNAP has been 100%. And I mean, to give benefit of, where it's due and grace for both the state and the feds, before the shutdown, the state did submit our HEAP plan for New York State, and then the shutdown happened, so we didn't have enough time to give the feds enough time to either approve our plan, and we don't know yet because the government has been shut down. So hopefully when it opens up, we'll have at least a timeline when we would know, hey, your plan was approved, yay or nay. Before this whole craziness happened, it was said, before the shutdown, it was said October 31, then the shutdown happened, then they said November 10th, and throughout everything that's happened with SNAP and everything, they pushed it to November 17th that we would have more clarification. So hopefully with the shutdown hopefully ending tonight, we will get that further clarification that's needed. At least the state would, and then they could give it to us.
Okay. But going back to Jamie's point, people in need haven't, you had 4 people as of last Wednesday. Most of the communications have been about when are they going to get their benefits, not
Yeah.
I need food.
Yeah, most of the communication has been when.
Okay.
Or coming in to do their recertifications because they have been uploading into the vendor system. So a lot of people have received notification, come in and do your recertification for your future benefits.
Yeah. And the food pantries, are you aware of are they overwhelmed or in need of assistance, food?
I'm gonna say I wouldn't be surprised if they are. I wouldn't be surprised just in the time that we are in. Unfortunately, I would say that depending where they get their resources from, depending if they're 501c3, if it comes from the food banks, depending where it comes from, is going to play a role. Depending how much they give out is going to play a role. But in terms of, it's not something that we didn't see, that I haven't heard, that they haven't seen before the government shutdown.
I really don't want to borrow trouble here, but in the event that the government doesn't open, what
What are we doing?
What are the next steps? So the SNAP for November, is that a temporary thing, or is that?
That's gonna be the next question that we did ask that question to OTDA, and then they didn't speak to us for 2 days because they said they were processing stuff, so. But that was the main question. Okay, we're good for November. What happens if this goes longer than November? They really didn't
So
have
we
an
don't
answer.
know. Okay.
Internally, we did reach out to Erie County. I reached out to my counterparts across the state from the commissioner side to inquire about any counties that have any contracts and/or agreements with any food banks and how they have gone about it, how they have funded it, and I should receive something within the next 24 to 48 hours from Paul Brady and the New York Public Welfare Association on who's doing what and how they're doing it to see what we can do here.
Great, thank you.
Thank you, Carmelo. That was the question that I was going to ask, is that's what we requested last Wednesday night, is for you to look into, and you are still waiting for information to give us advice as to what we can or should be doing in that regard.
Yes, the first ones we reached out to was Erie County.
Yes.
Our counterparts in Erie said that their agreement is not finalized yet. The moment it is finalized, they will share it with us. And that's when I decided to reach out to the New York Public Welfare Association.
Right. Okay.
Well, we heard that Erie County gave them $1 million to feed more. And that's the agreement you're talking about that has not been finalized?
There was
It was
mention.
stated.
There was a woman that,
There was
with
mention that
regard
there
to the
was,
woman.
there was a contract between the Department of Social Services and
Yes.
Feed More. So we asked the Department of Social Services for their contract to see what it looked like and what we can mirror, not to double the work, but also see how they process it. But they said at the moment it's not finalized.
Okay.
I think it's just a
Good to know.
streamline efficiency that would actually help what's already in place, but it would provide some assurance and guarantees. Yeah, so it's just, probably something we should pursue, even just out of being fiscally responsible too.
A comment, it's just, we aren't through this one yet, but it's good homework for in the future. Would we foresee another government shutdown for this duration? Maybe. And look at the work we've done to get through this one, and we'll have it in the record book for next time as well. So we're like, look, we've got a few plans already in place because we've been through this before. So, thank you for all the work you and your department's been doing to stay on top of this. And the work isn't going to go to waste either if the government opens, because we can save it for next time.
Yeah. Well, the reality is, and I mean, hope for the best, prepare for the worst. If the government reopens, it's reopening on the contingency of another negotiation on the end of January. So we are aware of that. It's not like it's reopened for until October 1 of 2026. So still got to prepare, and it's good to prepare. Have it and not need it, then need it and not have it.
Yeah, well, I guess I'm concerned about HEAP, because, there are food pantries for SNAP, but where do you go for HEAP?
I could give you, you guys did ask for some numbers for HEAP last time we were here, and we processed for fiscal year 2024-2025, 14,304 HEAP benefits were distributed in our county, which are 100% federally funded, and that was $6,405,647.
Holy cow. $6 million
And
in our
that,
county?
Carmelo, is for heating and cooling, correct?
Yes.
Yes.
What do you mean by cooling? In the summer, air conditioning?
Yes.
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 How about a fan?
Well, anything else?
After your emergency meeting last week, I felt that you and your staff were well prepared. And I'm thinking positive the government's gonna open tomorrow. So it's gonna be easy sailing, getting back to normal for you guys, for your staff? Or is it gonna be a big setback?
Well, it's ironic. I think we operate very well under crisis because we're always in crisis to begin with due to the nature of the work that we do. So to us, it was another day at the office. In a way, it's a good thing that we're prepared for it. So, finding the numbers with the help of finance, the help of mental hygiene, and the help of everybody, and the help of our counterparts, it's not that challenging to do. It's really just coordinating and the hardest part is waiting, to be quite honest, and waiting to hear what the governor has decided, what the commissioner has decided, what the law has decided as well, and seeing which way it'll fall. So good news that they're processing them, and hopefully we'll hear, hey, we're opening up, but also prepare for the next wave of whatever that next wave will be, because there will be a next wave.
Okay. Anything else?
Nice work, thank you. We appreciate the update.
Thank you.
Carmelo, well done to you and your
Thank you.
staff. Thank you.
Yeah.
Absolutely.
Absolutely, thank you. Okay. Do we have any other business? Okay, I will entertain a motion to adjourn.
So moved.
Second? Second. All in favor? Aye. Aye, we are adjourned. Thank you.
Thank you.